MD, Immunohematology and Blood Transfusion. Currently, he is Chief Medical Officer in the Department of Transfusion Medicine in Indira Gandhi Govt General Hospital, Puducherry. After the delivery of her talk, 10 minutes time will be given for question and answer session, and during which you may ask questions or you may type your question in chat box. So thank you one and all. Now the platform is over to you, Dr. Diana.
A very good afternoon. Am I audible now? Very good afternoon to all the people gathered, giving your time for this webinar. I begin my talk with a note of gratitude to DDE, our director sir, faculty who have given me this opportunity to share the science and the knowledge along with my experience. I will try to go very slow, and at the same time I would like to cover all the points. If you have any doubt at the end, you can ask me. So we'll start with blood donation. So I'm aware all of you have an idea about blood donation. You would have donated so far once, or you may be planning to donate. But why should even someone donate? So that is the question. Why should someone even donate? The answer is very simple. Blood is a wonderful fluid or elixir of life. The beauty of nature is blood can be synthesized only in the human body. Therefore, the source of blood is from another human being only. So far, science going towards synthetic blood is only in research phase. But as of now, we do not have currently any synthetic blood in market. So that itself signifies the point that why someone has to donate. Your body is the source of blood for a patient. Now in India, we have a requirement of 15 million units every year. 15 million units. Roughly in a hospital setup, every 2 to 3 seconds, a patient is in need of blood. Whereas the number of units donated are around 8 to 10 million units only. So here we can see there is a gap of almost 5 million units. So why should you donate? Now, after you donate, who are the patients who need your blood? The emergency patients are those who are bleeding, like accidents, trauma, then patients in delivery room who are delivering a child, massive blood loss. So no matter how much the doctor is skilled, how much we are skilled, once the patient goes into massive bleeding, then the blood is the only option which will save both the mother and the child. Then patients with chronic anemias. Then cancer patients. Yes, now there is an increase in cancers. And in our regional cancer center in Jipmer, we are managing hematological cancer patients who are very much in need of blood almost throughout their life. So you can imagine how much it is a burden for the patient as well as the family members. Otherwise, blood is required for burns patients, children with the chronic diseases of blood. So this is just a gist I'm giving you. There is a vast requirement of blood. Now I'm coming to the topic proper. Why should anyone be a voluntary blood donor? This is a very important question. Why should I donate? Why should I be a voluntary blood donor? The difference between a voluntary blood donor and a replacement donor is very simple. A voluntary blood donor comes out of his own free will without any motive or intention. If you are a replacement donor, you are coming for some patient, some friend, some family member, and you know for whom you're giving. So, whereas a voluntary blood donor, he doesn't mind for whom his blood is going, or he doesn't even know anything. He just comes out of his free will. So even so far, if you have donated as a replacement donor for some family or friends, you can come once again as a voluntary blood donor. This is my humble request because most of them are young people, students here, Please come forward as voluntary blood donors. You can register in the nearby hospitals, blood banks, bring 10 of your friends, try to organize a camp. It is a very big contribution to the community. Now, a voluntary blood donor is not under any obligation or pressure. He is not being paid. In India, still we are having a big number of network of agents, paid donors. So they are paid donors. They are called as professional donors. In the 1980s, they were very much high in number. And after the outbreak of HIV, the government got very alert about this. And now we are trying to reduce maximum of agents and paid donors. Patients are poor. At an emergency, due to the pressure, they will resort to paying and getting blood. This can be completely abolished when the voluntary blood donors come forward. Do come forward and support the poor patients. It will be very much helpful to them. Next is, as I already told you, the voluntary blood donors do not know for whom they are giving. And they are more likely to be of free will and without any pressure. So they will disclose any illness, any history of any high-risk behavior when we are screening the donors. And one important point is when you become a voluntary donor once, there is more likely possibility that you will motivate others and bring 10 more people. Now, coming to a gist, just a small gist, I would like to tell who all can donate. Anyone who has completed 18 years of age, both male and female can donate. There is no difference that females cannot donate. In India, still 80 to 90% are male donors, and it is only 10 to 20% female donors because of all the doubts they have. A weight should be minimum of 45 kgs depending on your build, and your hemoglobin should be more than 12.5 grams. And in your general medical checkup, everything should be normal, blood pressure and all. I'm not going into the details of all the criteria. You can communicate to me or to Didi. I will give the details. If you want, I can send you a mail also if you want to know the criteria. Who all should not donate? There are various criteria for who should not donate, but I don't want to go into the detail. I'll just give a gist. Anybody having any active infection, any recent fever, any major surgeries, tattoo, history of jaundice, these people cannot donate for a period of time. Now, when can you donate? How frequently you can donate? A male can donate once in 3 months. Yes, once in 3 months. A female, it is once in 4 months. This once in 4 months or 3 months is 90 to 120 days, the average lifespan of the red blood cells in the body. Now, finally, coming to my actual topic, what are the benefits for the donor? First, we'll see into the health benefits. See, usually in blood donation camps, we talk what are the benefits to the patient. But here I am to focus about the benefits to the donor who is donating. First point is your hemoglobin will increase. Your blood will be new, fresh bloods. How is this possible? When you donate, there is a loss of blood from your body, which triggers your bone marrow. So what will happen physiologically in a normal person? The bone marrow gets triggered and it starts producing new red blood cells, which is the fresh RBCs. Hence, your blood will be renewed when you donate, which will give you more stamina and energy. Second point is, these are all proven studies which I am stating. This is not any claim. These are all scientific papers, research papers published and accepted. There is proved evidence of decrease in hypertension. Somebody who is a hypertensive, if he is on control, he can donate. If he is a regular voluntary donor, by means every 3 months once or every 4 months once, he or she, if they donate, there will be a decrease in blood pressure. And there is a very huge amount of evidence proving that a person has a very less chance of heart attack, heart disorders, if you are a regular blood donor. Why? Reason is, when you donate, there is a loss in blood volume, which will lead to decrease in the thickness of the blood. We call it as viscosity. So thickness of the blood decreases. Hence, somebody who regularly donates, provided he or she has a healthy lifestyle, that is very important. Somebody with a healthy lifestyle who regularly donates has 88% less chance of developing a heart attack. Mind you, heart attack, we are seeing a wide increase in number of cases with myocardial infarction or heart attack as we call it. A very huge rise in numbers. Surprisingly, the age group has fallen now down. We are seeing more in 30s and more in males and females, especially post-COVID. So what I'm trying to signify here is please maintain a good general health and also come forward to donate. Another important proven study is decrease in blood cholesterol. Yes, when you donate regularly, there is proven evidence that there is a decrease in your blood cholesterol levels. And there is definitely a 33% chance of not developing a blood cancer in your entire life. Yes, blood donation is proven to decrease the risk of cancer, any type of cancer in any age group, provided you have a healthy lifestyle. Healthy lifestyle is the first point. Blood donation will add on to it. Finally, I'll talk about the mental health of someone who donates. See, if you donate regularly, you will feel good. Suppose imagine you're walking on the road and you're seeing somebody who's trying to cross, a blind person, or you're seeing somebody who's injured. Despite your hurry to go to office or college, you're leaving your vehicle down and you're running and going and helping them. This small deed will give such a boost of happiness for you, which will be there in your mind throughout the day. And after that, you'll go and tell it to your family and friends. Why? Because we are human beings. We are born to be social beings. Social commitment, your commitment, social responsibility, the activity you do to the community is very much important. Sadly, because of too much of addiction to mass media, phone, and all these kind of electronic devices, nowadays people do not seem to be much aware or sensitive to the social needs. My dear friends, I'm taking this opportunity to humbly request you, please come forward and get sensitized in any hospital what is the need for blood. You will be very much surprised that there is a huge gap in the need and the actual donors. Come forward. Donating is a duty for you, the community, and for yourself also, because tomorrow you may be a patient and you might be requiring blood. So let's not go to that end. Come forward and donate. Motivate your friends. So altruism, you will start feeling so good when you donate. You'll feel a glow, a sense of achievement in life. I have seen one donor who was so depressed. He was not diagnosed with depression or any psychiatric illness. The person had undergone a sad phase in his life. He was depressed. I just suggested him, why don't you come forward and donate blood? You will feel better. Surprisingly, after donation, his mentality improved very much. He started asking me doubts about donation and everything, and he started bringing donors. I'm just quoting this as an example to you. Gives you a general contentment in life, reduces your stress, and if you feel depressed or isolated, anything can be the reason, because of your job, because of some financial status, whatever it is. If your body is healthy, suppose you feel, I'm feeling depressed, I'm feeling low, come forward, fill a form, give blood, and you will see the difference. Definitely, you are saving patients. So that is importance about community participation. Last is about loss of calories. When you're donating blood, you lose almost 500 to 600 calories. This is a proven study. It's not a claim. So we often advise our donors, you don't have to go for gym today. So it is almost like one day of your gym activity, isn't it? So when you donate blood, you're almost losing 500 calories of blood. 500 calories of energy. Now coming to the health benefits. What are the health checkup benefits? You are getting a free health checkup. Yes, you are getting a free health checkup. What do we check when you come for as a donor? First thing we do is we check your weight. Believe me, surprisingly, many times I have diagnosed underweight, obese people. First time they are not even aware they're obese. So yes, you can check your weight for free. And if we find them to be obese, I give them all advice, general advice as how to reduce weight. Then we get a checkup on your pulse and blood pressure. Not surprising for me, because many times we see people, especially in middle age group, they have never checked their blood pressure even once. It is so sad state of affair. Please take care of your health. Not even a general checkup done once in the they come with a high blood pressure. We will not be taking them and we will refer them to medicine department for further evaluation. So see, at one stop, you're getting your blood pressure checked, your pulse checked. Very rarely, we have even picked some cardiovascular cases, cardiology cases in our general checkup. It is a mini physical examination. And of course, we check your blood group. You get a chance to know your blood group. Many times you'll have doubt. You'll get a blood group checked up. And if you're a rare blood group donor, say for example, AB negative, it's a rare group, less than 1% prevalence. So we will collect your name and we will use your blood when in need. And also we check your hemoglobin. So hemoglobin, I told you, simply put, hemoglobin is present in your red blood cells. It is a level of your iron content put indirectly in your blood. Hemoglobin is important for carrying oxygen in the RBCs in all your tissues. When there is a fall in hemoglobin below the normal level, that's when anemia. So for blood donation, it has to be a minimum of 12.5. Usually for females, it's usually less than 12.5 because in India, anemia is very, very prevalent. I'll go into the topic with few points. If you are having more than 16.5 is also abnormal. So a range of 10 to 16.5, 16 seems to be normal for both male and female, I'm telling. So we have diagnosed many patients. It's very common, anemia, very common. Rarely I have diagnosed patients with high hemoglobin also. It is a condition called polycythemia and we have diagnosed. So see, they came for a general blood donation and they were diagnosed. So we give them all the diet correction and if needed, we give iron supplement therapy also. Very important, we test your blood for infections. Yes, it is very, very important. So what are the infections we test for? We do testing for HIV, hepatitis B virus, hepatitis C virus, syphilis, which is a sexually transmitted disease, and malaria. So these are the 5 tests we do in all the bloods that we have collected. All the units we collect, we do this testing because to make sure your blood is safe for the patient. And if any of the units turns out to be positive, it is highly confidential. Do not be afraid. We will not disclose it to anybody. We will call you. And if you are any of this positive, we try to disclose it to you and we refer to the medicine department. Here, I would like to add a point. Recently, we are seeing a rise in hepatitis B virus infection, quite high. What I used to see 5 years before, now I'm seeing almost double the time. And surprisingly, syphilis, which is a sexually transmitted disease, also seems to be on the rise because of high-risk behavior. So please be safe on your side. And when you're donating blood, you're getting a free testing checkup also. Lastly, your blood on visual examination, sometimes we will be able to pick up high cholesterol. Yes, we do not do testing for cholesterol, but we have seen many cases where the blood itself will be thick yellow in color. Yeah, surprisingly. Even once I had a donor whose blood was like in the color of butter. Yes, butter. It was literally like a butter and beneath the bottom cells, the red cells were floating. I was so surprised. I have never seen like this. Then immediately I called the donor and I advised him, please check your cholesterol. He was only a male of 25 years. He was not aware of any hyperlipidemia or increased cholesterol or any family history. So he was a first-time donor. I saw the tube and I called him. He was very cooperative. He came back. We checked his cholesterol. It was surprisingly very high. All the LDL, HDL, all the lipid parameters was very high. And then immediately we referred to cardiology department for further drugs. See, if we have not picked up this donor, who knows, he may develop all cardiovascular risk within next 5 years, which is life-threatening. So yes, we check your cholesterol and your jaundice status also will be visually seen in the blood. Few points about pre-donation. You have to sleep for 8 hours before you donate. You have to eat within 2 hours before you donate. And please disclose any high-risk behavior questions which we will ask in the counseling before donation. Disclose if you're under pressure. You don't have to give under any pressure. You can disclose it to us. If you have any types of anxiety, needle anxiety, blood anxiety, please be free to communicate with us. We are health staff. We are so frequently seeing donors, so we won't be surprised. We'll be very supportive to you. And clear any doubts you have, and you have to give consent before donating. After donation, you have to take plenty of rest the whole day. Please avoid exercise, gym, driving, going near any heavy machineries. You must avoid this. It's a chance of you developing some diseases. Please take plenty of fluids, juice, all kinds of fluids, plenty. Avoid going in the sun, standing for a long time. Take diet which is rich in iron and avoid any exercise. The entire donation process will take 45 minutes to 1 hour. The actual time when we take the blood, the bleeding time is 8 to 10 minutes only. So see, when you spare 1 hour or 45 minutes to 1 hour of your time, you are going to save 4 patients. Yes, that's a surprise. Now you're going to ask me, how am I going to save 4 patients? With one donation, we will separate your blood and make it into 4 components: PRBC, plasma, platelets, and cryoprecipitate. So 4 components. So once you donate just 45 minutes of your time, you are going to save 4 different patients. Please get motivated. Come forward. We need youngsters. We need the community support. And we will always be there to give back our feedback and support you too. And coming to the general few more points I can add about the general well-being. Scientifically, it is proved that a person who exercises lives longer than a person who does not exercise. Even though the person has diabetes, hypertension, anemia, autoimmune disorder, it doesn't matter. A person who regularly exercises will have a longer lifespan. He outlives a person who doesn't exercise. Ideally, you have to exercise 30 minutes a day, at least 3 days a week. Minimum of 3 days a week makes a lot of difference. See, exercise doesn't mean immediately we have to go to the gym and lift weights. No, not necessary. Start with mild walking. Walking is very essential. Walking increases the blood pump by your heart. That blood will clear all the blood vessels. Even if you are having some disorders, start by slow walking. You can walk. Swimming is an excellent exercise. And then you can go, provided you want to do some muscle building. Here, I would like to add a point because I'm seeing very common in youngsters. They are taking a lot of steroids, whey protein for gym. Whey protein, provided it is actual true whey protein, it is going to be healthy. What we see in practice in markets, it's not real whey protein. Students and my dear friends, please don't get carried away by this idea of taking whey protein. What will happen if you cut your calories and start drinking only whey protein? You are overloading your kidneys with increased protein. And we see many, many youngsters landing up in renal problems. Please don't do that. Take a diet rich in protein, both vegan, vegetarian, non-vegetarian. There is a lot of sources for protein-rich diet. Your body also requires carbohydrates and lipids. So take a balanced diet. That's what matters. And avoid taking any steroid powder, steroid injections. Recently, I'm surprised even patients are taking, public are taking insulin for muscle building for all this competition. It is very unhealthy. Eventually, it will affect your heart and you will die at a very young age when your kidney and your heart fails. This is my prime duty to inform this to you. So iron-rich diet, yes, jaggery. Jaggery is a good iron-rich diet. Okay, peanuts, pomegranate, beetroot juice, spinach, green leafy vegetables, broccoli. Okay, and if you're a non-vegetarian, all red meat, mutton, much better is beef, then liver. These are all good sources of iron. So iron is mainly dependent on your diet. If you take good diet, your blood synthesis will be good. Exercise regularly. Then I would like to add a few points where the awareness is lacking, where you lose blood. Where do you lose blood and you ignore it? Especially girls, females out there in this meeting. Please check your menstrual blood loss. You will be aware when you start losing more blood during your menstrual cycle. When the flow is more or the duration is more or you're changing more pads than the normal. It is not normal. If you're passing blood clots, it is not normal. You're losing blood. Many, many young females I'm seeing who are coming with a very low hemoglobin, who have not checked a doctor. Why? Because of stigma. They're afraid. They're ashamed to go and talk. If you're so uncomfortable, please approach a female doctor. Get your menstrual health checked. And for women above 45, 50, perimenstrual menopausal blood loss. You will have menopause. So during that time, this is a message for your mothers also. All of you are attending this meeting, your mothers at home, they will be around menopause and they will be very ashamed to tell it out. They will be losing all the blood. So eventually what will happen? They will become anemic. They lose all calcium in the blood, osteoporosis. So please check your menstrual blood flow and get it corrected from a gynecologist. Another common cause in India is worms, hookworms in the intestine. Get yourself dewormed. The National Health Program gives free deworming tablets for children in school. You can also get in a nearby primary health center. It's just a tablet once in 6 months. Just twice in a year, you're going to take it. It is a single tablet. It will deworm. It will clear all the worms in your stomach, because no matter how much of healthy iron diet you take, if you don't check the blood loss, it's like a tap open and the water is running down. So whatever iron you put, it's going to go out of your body. And last is very common. What I see is hemorrhoids, or in common terms, piles. Loss of blood through when you're passing feces. That is a condition in your intestine where your veins bulge and it loses blood. Again, people are ashamed. There is a stigma. Please don't feel ashamed to approach your doctor. We are specialized in this and we will help you. If you're not going to get this corrected, you will lose lots of blood and you'll land up in anemia, even requiring transfusion. Last few points I would like to add about high-risk behavior. Yes, high-risk behavior for getting all these infections, hepatitis, HIV. I'm seeing a lot of cases happening now. Why? Because of tattooing. Yes, you can tell, no, we are doing tattoo in a parlor, but there is no specific guidelines for tattoo parlors, and the needles which they even open from a new cover, how sure are you it is sterilized a new needle? Please avoid tattoo if possible, because people who take tattoo land up in hepatitis B or hepatitis C eventually. Please get yourselves vaccinated with hepatitis B vaccine. Next, high-risk behavior, needle sharing of drugs. Please avoid it. There is a high risk of HIV and hepatitis. Last is sexual behavior. Please be careful of your life. It is very important. Once you turn out to be hepatitis B positive, there is no treatment. You land up in liver failure and you will die before 40. And there is definitely no treatment for HIV. Very sadly, we do get even donors who become HIV positive because of high risk behavior. Do not involve in unnecessary activities in your life. Stay healthy. Last few points about road traffic accidents. We are seeing a lot of road traffic accident cases. Please be safe on the road. We are seeing a lot of young people dying, and mental health is very important. Please take care of your mental health. Among your friends, if you notice anybody is showing any signs of depression, please approach and get it corrected. Just one more point. There is something called as apheresis donation, which is done in Jipmer. We donate blood and take it in a machine. Okay, it's not available in our government hospital, but apheresis donation is very special. We use it for chemotherapy patients. Any one of you who is anybody is volunteering for apheresis donation, you can approach me or DDE and I will help you to become a donor in JIPMA. Thank you, friends. Now, any doubts you can ask me.
Let's say that they can type in the chat also.
Okay. One more point, this fish pedicure. Fish pedicure is also very much happening. Yeah, surprisingly, one patient developed a very bad bacterial infection in her foot. These fish will bite everybody, no? So they will have exposure to blood. So don't get yourself infected. And that girl almost went to losing her limb. We have to amputate her below the ankle because she developed a bacterial infection. Please avoid this fish pedicure.
Any of you having questions, you can raise your hands and you can voice out the question. Or else you can type in the chat box also. The question answer session will be for 15 minutes. You can utilize this opportunity now. If you have any doubts regarding any of the topic, just Dr. has conveyed.
Can you type the question, please?
You can ask Sibin has raised the hand.
Thank you, Parvati. Thank you so much.
Sibin has raised the hand. You can ask.
Yes, please, can you type your question? Sibin has raised your hand. Should I unmute them?
No, it's unmuted already.
Okay.
It will take some time for the break, guys. One will start, then others will add.
Yes, beef is red meat. It has a very high good iron content. But the problem, one problem with beef is if you don't cook beef properly, you will get a tapeworm infection, which is called beef tapeworm. So if you cook, if you're a regular person who takes beef, you better have it at your home. Avoid taking beef outside. If it is not cooked properly, you will end up in beef tapeworm infection, which will affect your brain.
Is it the same for pork also?
Yes, we have pork tapeworm also. It should be cooked at home.
After blood donation, how much?
Yes, that is a good question, Sabrina. Then you can take rest for the next one full day. Please avoid sports, going out, driving, machinery. Yes, we have a tablet called albendazole. It is a very simple drug. It is 400 mg single dose.
You read the question and then answer.
Yes. Oh, okay. So a question from Trideep Kundu. Can you suggest a medicine to deworm and how often should we take it? Albendazole. Albendazole you will get it in a nearby pharma and you have to take it one single dose in a night. Nighttime is preferred. You may experience a little bit of abdominal cramps and all if you have lots of worms. Don't worry. All the worms will be destroyed and you should repeat it after 6 months.
Can you spell it?
Albendazole. ALBENDAZOLE.
In a year, how many?
In a year, yes. Sendil Kumar has asked a question. In a year, how many times we can donate blood? As I told, a male can donate once in 3 months. Female once in 4 months minimum. At least make sure, please, friends, at least try to donate once a year, twice a year. Come forward, please.
Okay, so
Radiation workers can donate blood, no problem, provided your dosimetry and your tag, everything is fine. If you're not much exposed to radiation, you can donate. That is not a deferral criteria. Yes, somebody has typed albendazole. Thank you. Ansifi. Bhagish Datta Mishra, is there any relation between blood quality and age? Minimum, maximum age. Good question. The minimum age, as I said, 18 should have been completed. Maximum is 65 if you're a regular donor and 60 if you're donating for the first time. People who have tattoo can be a blood donor from Sarath Krishna. Tattoo, 1 year you cannot give. If you have taken a tattoo, please avoid donation for 1 year. After that, you can donate because of the incubation period of hepatitis B virus. Yes, the albendazole, Murlidhar has asked half the dose in pediatric population, children. Okay, albendazole, somebody has asked, albendazole, what type of food we eat at night? No problem, you can have a normal diet, something not very heavy, and take albendazole before going to bed. Ajay Iyer has asked a question. Symptom for what? I'm not able to get. Yes. Yes, ma'am, how much ml of blood do they take? Yes, it's a very good question. Sabrinathan, we take 350 ml of blood and sometimes there are 450 ml of bags, 450 ml bags. Common in India is 350 ml because your total blood weight, total blood volume depends upon your weight. And you will see satellite bags, don't worry, that is for separation. Because last camp, we did have a problem. The donor got little worried why there are so many bags, that is for separation. For all, Ajay Iyer, for all blood-related issue, you have highlighted. Oh, thank you so much. Thank you. Okay. Any other questions? Symptoms, I'm not able to get. Is it for anemia? Okay. Okay.
how much time to cover back? That is, they're asking when it will rejuvenate again.
Yes, that is the same thing I told you. 90 to 120 days. That is the lifespan of the red blood cells from your marrow. Nature is wonderful. Your marrow is very much stimulated always. When you lose blood, it will immediately trigger and produce, provided you give good iron to the body. That's what I was insisting. Please give good iron to your body. Only your diet is the source of iron. Take iron-rich diet. Nowadays, the sad part is this generation, many people are eating fast foods. Please avoid. Here, I would like to add a point. This is only among us, okay? So here in Puducherry, many hotels, the food safety committee had done a visit and very sorry, surprisingly, the meat storage is very bad. I would not go into the details of the hotels. Frozen food is very high in Puducherry. We are seeing lots of food poisoning cases also. Kindly avoid out if possible. Avoid non-vegetarian, please. And Avoid non-vegetarian, and important, please avoid raw vegetables like sandwich, salad. Why? Because the vegetables are not cooked. The cook would have cut his finger. Blood would have mixed with the blood, with the vegetables. That could be a reason for hepatitis B. Ma'am, is there any way to check we have more blood or not? From Sabrinathan. Good question. You can do a blood checkup, routine blood checkup. Yes, you are supposed to eat iron-rich diet even without checking your blood. Nowadays, all fruits and yes, it is exposed to pesticides. Pesticide Control Board is taking action. One simple way I will tell you, please wash your vegetables with hot water with some salt or vinegar. Yes, madam. Yes, I'm a voluntary donor, ma'am. Every 3 months, 2 times. Allergy like rashes. Okay, this is a very simple. In Rio, maybe you're allergic to the spirit which was put in your hand or the betadine. Some of them are allergic to the plaster. It is not a deferral problem at all. Please approach the blood bank doctor and tell it prior to them. They will use some other disinfectant. It is only an allergy to the chemicals. Nothing to worry. It is not related to the blood. What eat regular food to improve good blood cells? Giridharan has asked, as I have told you, iron-rich food, which I have told you just now I told, vegetarian and non-vegetarian. It is put very simply. Many of you will be dietitian students also. Your blood pH is very important. When you take a lot of alkaline food, vegetables, fruits, these will balance your cells in all the body, thereby reducing all this heart attack and cancer risk. When you take food with a lot of acidic pH, meat, rich in cholesterol and sugar, all this have proven to increase heart disease and cancer. Recently, white sugar is called as white poison. I'm telling, but even I'm not able to completely stop white sugar. Please, if possible, you avoid all the 3 white sugar, white salt, white maida. Please avoid this in your kitchen. Yes, madam.
There's a belief that if you cook in the iron vessel, iron will increase. Is it true?
It is a proven fact only, but now it depends on what quality of iron utensil we are using. At least avoid non-stick. If you're using non-stick, please use wooden spatula. Don't use the metal. It will scratch the Teflon and Teflon will mix with the food.
So it's good if you cook in
Yes, madam. Yes. Provided you have good quality of the vessel. Nursing student, Ansi Fee. Thank you, Ansi. Trideep Kundu, what is your doubt? What is the alternative for those? Alternate food? Are you asking alternative for what? Okay, Ajay Air, good question. Any symptoms of blood-related issues, especially hepatitis? Very good question. Hepatitis, definitely you will have a history of jaundice. Yes, you will have fever and jaundice. What do I mean by jaundice? Your eyes will become yellow, your skin in your palms will become yellow, your urine will be more yellow, and you will have fever. That is a symptom of hepatitis. If you develop hepatitis, immediately go to a hospital, get it checked, and see what type of hepatitis. White maida, atta. Yeah, thank you.
Atta is alternative.
Yes.
Like sugar, jaggery.
Okay. Yes, for sugar it is jaggery. And salt, yes, you can try this rock salt and this pink salt and all that, but still it does contain sodium. We recently had a talk on renal failure at a younger age group. We were so surprised. It was talk was given by a nephrologist. Do you know what is the sodium content in Maggi? Anybody? Because they are all students, I'm so happy to discuss all these topics. Anybody knows what is the sodium content in Maggi? If you have a Maggi packet also, you can see.
Ma'am, one question I have.
Yes.
My friend have a hemoglobin 21.
Yes.
So he have to donate blood every 3 months. What is the reason behind it?
This is not a normal condition, Harinder Singh. It is called as polycythemia. Polycythemia is the opposite of anemia. It is a blood disorder. So subtype of polycythemia is also a blood-related cancer, but I cannot confirm it now. Don't have to go and tell your friend. It could be a blood cancer. Polycythemia, one type is a blood cancer. They have abnormal marrow producing abnormal cells. So the only option we have is we give tablets and we try to remove the extra blood. That's why he's giving every 1 month or every 3 months. That blood which we take from a polycythemia patient, we do not use for another patient.
Okay, thank you, ma'am. Thank you.
Thank you. Trippe Kundu, yes, very good. Maggi contains almost 2000 milligrams of sodium. Honestly, even before attending that conference, even I never knew that. Now the FASI has been, all the doctors, Nephrology Association, we are requesting Maggi to reduce the sodium content. Please be aware that is directly related to the second question. Why cancer cases increasing day by day, ma'am? Exactly, 21st century, somebody has asked that question. Both the questions are related. Can you see? You see the answer in front of your eyes itself. I need not tell you. Please avoid Maggi, because Maggi itself has, the noodles part itself has some maida and some sort of agents to make it soft. Added on to that, the masala which you add on the top is having so much of sodium. This is only the tip of the iceberg. The only thing which we spoke was Maggi. How many of you have the habit of opening the snacks box biscuit before opening? How many of you have the habit of seeing the contents? We don't do that. We are educated people. If we don't do, imagine the public. Kurkure has so much of plastic content in it. These are all proven studies. I'm not claiming here. I'm not attacking any brands. I'm just sharing it out of concern for my friends here. Please share this knowledge, because students take a lot of Maggi. Not only salt, you see there will be added preservatives. For example, Amul butter, it has so much of salt and added preservatives. Biscuits, a normal biscuit, for example, any of the normal biscuit, don't even have to go for any cream biscuits. The normal biscuit, if you take, see the carbohydrate content. A small 5 rupees biscuit packet will have around 40 to 50 grams of sugar. Then you can calculate the calories. So see how we are spoiling your health. So to conclude, I would like to say, follow the food diets which your grandparents followed, your great grandma ate. If your grandparents didn't eat it, you don't eat it. Try to cook as much as possible and have it at home. If you're having it outside also, avoid all the salad, sandwich, raw vegetables, avoid non-vegetarian, because personally, myself in casualty, I have seen so many cases of diarrhea who ate outside. I don't want to tell the hotel's name. And non-vegetarian meat preservation in Puducherry is very bad. Green revolution is a curse or a boon. I am not scientifically qualified to comment on this. I am sorry. Because, yes. Iron tablet, you can just generally go and ask in a medical shop. They will give you. There are so many formulations. You can take whichever you want. Ferrous fumarate is good for your gastric upset. The problem with iron tablet, it causes gastric irritation. That is why many of us start and leave it. Fifol is good, doctor. Muralidhar, Fifol is good. Fifol Plus is there, which has some folic acid with it. And we have ferrous fumarate. Ferrous gluconate is good. Don't go by brand name. You tell the, Fifol Plus. Yes, it's good.
Any kind of greens that will boost the iron.
Any greens. Nature is wonderful. Please eat green leafy vegetables, broccoli, peas, whatever is green, whatever is leafy. How many of us are eating vegetables regularly? Yeah. Please see the ingredients. Please see the carbohydrate content. Okay. And see the calorie content. Okay. One interesting point. I'm sorry if I'm taking your time. Just 5 minutes. One interesting point. 1 can of Coca-Cola. Sorry, even I had a little bit of Coke 3 days back. I couldn't avoid it. I'm being very natural here. Just sharing with you. 1 can of Coke, how much of sugar does it contain? Yes, almost like 1/4 of the can is sugar. If you just take an empty Coke can and start adding sugar, 1/4 to 1/2 is sugar, white sugar. And you can ask me why white sugar is proven to cause cancer. These are all recent studies. 5 to 10 years later, these studies have come. White sugar causes an N-glycated product. We call it as GP, N-glycated product. That's how sugar metabolizes in your body. Now, this N-glycated product is very sticky. So it goes and sticks to your cells. Normally, any cell in your body, suppose it becomes a cancer cell, your immune system has the ability to strike it out. It's not that we are not at a risk. All of us are at a risk. But when you take lots of sugar, when you have a sedentary life, when you don't exercise, your immune system comes down and it's not able to break the tumor cell. Definitely, sugar will boost the cancer cell to grow and develop. So that's why I'm telling, please avoid. It is a message for myself also. What is the root cause of reducing average age of human in India? Yes, 21st century. Yes, I can add 1 point. The coronary artery disease or the heart attacks. All this, we are more at risk. Do you know that? Because of our race. Okay, we are more at risk than Caucasians, Africans. Why? Because of our race. Genetically, our blood vessels are much narrow. than the average blood vessel of other people. So there itself, we have a high risk. Other thing is, we are having a diet which is more in carbohydrates. Initially, our forefathers used to eat healthy diet and work equally. Now, because we are all students, office people, everybody is sedentary. We don't have time to work out. So please take a good calorie restricted diet, healthy, balanced diet, and do good exercise. Now, there is dietary requirement charts. You can Google and see. That is the ideal. When you enter your age and your gender and your weight, the chart will calculate and tell you what your actual weight should be, how much of diet you should take. Akash, can you please tell what is the main care? This is of blood cancer. Okay, this is a very common question I get. Unfortunately, we cannot point out what is the cause for cancer as such. Sadly, in my entire career, I'm seeing a lot of cancers now, young age, children, leukemia. We see so many children with leukemia, so much of cancers, but sadly, science is not able to point out to one specific reason. Broadly, we can tell about our genetic cause. The environment has changed. We are exposed so much to UV radiation. When you go out in the sun, you know the difference. UV radiation so much. We are near the equator. So a lot of sun damage, direct damage on our body and our diet. You know now plastic has been found in the human body. I think you're all aware with the recent studies. In human tissue, when they did study, they found microplastics. So I can't avoid drinking water when I'm traveling. I have to take it from a plastic bottle, isn't it? I eat with a plastic spoon. So please, yes, thank you. Thank you, Ansife. Teacups. So when you're going out, try to avoid taking hot food in a plastic container. Because of Swiggy, thanks to Swiggy and Zomato, I'm sorry to mention the brands, but they are causing a lot of obesity in Puducherry because when you want something, you order and you eat. So avoid that. And it comes in plastic containers, very, very hot. So when that heat, what will happen? The plastic will start melting and mixing with your food. Avoid taking hot things in plastic if possible. Try to take water in stainless steel bottle. Try to take, see how our parents lived, how our grandparents lived. That is the healthiest way. I'm not here telling try to implement new things. Implement what your grandparents did. Yes, food products and ingredients page, you can check for all the calorie content, sodium content, and sugar content. Ma'am, distillery water bottle use or not? When you're traveling, if there is no other option, you have to use it. I understand. And I don't want to suggest any brand or anything. Try avoiding. If possible, you carry your stainless steel bottle filled with water. I go around with my bottle with water. I don't. Yeah, Akash, thank you. So we'll wind up. Thank you, friends. Thank you for this opportunity. Thank you, DDE, for giving me this platform to meet so many young people, my friends. Thank you so much. Any doubt regarding blood donation, you can contact DDE. Madam is here. I will get the questions. I will try to share the PDF and all about the blood donation benefits. I will be very happy if at least one of you come forward as a voluntary donor and bring donors along with you. Especially in this dengue season, we are a lot in need of platelets. Your donation, your blood is very valuable to me, to us, to the patients. This is a service you're doing to the community and to the nation as a whole. Thank you very much.
Last month we have conducted on blood donation camp and it's a continuous process.
Yes. I would like to take this opportunity to inform you and to thank DDE because DDE wonderfully organized a blood donation camp. We had it here in our DDE campus. We came from government hospital and we collected blood, almost 40 donations. It is a very big number. Students came so much enthusiasm. Staffs came with so much enthusiasm. We had a good collection and all the blood was utilized for dengue patients, cardiac patients, anemia patients. I'm very much honored to take this opportunity to thank DDE for such a big help for our GH patients. Because GH patients are really poor patients. They don't have attenders. They're from other states, outside states. Your blood matters so much. There is one instance I would like to mention. We saved a patient with 40 units of red cells. One patient received 40 units. The patient had a road traffic accident and one of his important vessel in the neck was cut, directly in the neck. He was somehow lucky to be alive when he reached the hospital. This case happened in Jipma. So immediately the cardiovascular team took the patient. So fracture, everything we were able to correct, but the blood loss directly from your blood vessel in the neck was very difficult. Luckily, we had so much of stock. See, this case, if I had gone to some other hospital where there is no blood or some primary health center, he wouldn't have survived. Because we had the surgeon and our blood bank, we were so ready. We said, go ahead, sir, we will support you. We gave 40 units of blood, and today patient is alive and healthy. He is around 25 to 30 years age. He is healthy today. This is just a small example I'm telling you. So many delivery patients, so many mothers have been saved by your blood. When the minute on the delivery table, when the baby is delivered, if the mother, that blood will be so much, the loss will be very much. I'm not talking about normal delivery, about those who go into complication. N number of surgeries, N number of technical skills will not save the patient. Blood will save the patient. Thank you, friends.
Thank you, students. We are ending our session here itself. And about our next program, we'll intimate you soon. Just a minute. Students, if you are interested, we have already sent you Google form to you. If you are interested to deliver your talk, you can fill up the Google form and send back to us. Okay. Thank you.